All right, you ready, everybody? Hi, today I'm going to show you my visit at the dentist, my office, getting a cleaning. This is Dr. Tamisha Denis, and this is the Modern Smile. You calling me? I'm pretending to be a patient. Yeah. I'm inviting. Listen, and I don't need a long cleaning, okay? Like, I literally need like a 10-minute cleaning. So when you have your teeth cleaned, the first thing that the hygienist typically does is she checks your teeth in general. Although the dentist is going to be the one to diagnose any cavities or fillings or any other dental work that you need, what the hygienist will just do a gloss over if they see anything that they feel like the doctor has to take a look at. Also, what the hygienist will do is what they call a periodontal probing, which just basically means that she's going to check the space between your gum and your teeth to make sure that you have good gum pockets or periodontal pockets to make sure they're healthy. We like to say that numbers 1, 2, and 3 millimeters are good, and numbers like 4, 5 can indicate gingivitis or gum disease. Any numbers beyond that will also indicate bone loss, which is gum disease. So the first step that you'll see her doing is using something called a Cavitron. And a Cavitron is a machine that vibrates. It has an ultrasonic tip, and it vibrates and helps to loosen the plaque around the teeth. Now, she was going around all of my teeth, and to be honest with you, it had been a little bit longer than I'm proud to say with my last cleaning, so she was really getting in there, and it felt kind of strange. I always say it's like pleasure pain, because I'm so happy that she's cleaning my teeth very well, but then it's like, ew, that feels strange. So she goes around and it helps to loosen all of the plaque. The ultrasonic tip also spits water, so you'll see ever so often I'll use a suction to get rid of some of the water. So what it does is it just loosens that up, because before she goes on to the next step, then it becomes easier to pull the plaque off of the teeth. The other great thing about the ultrasonic scaler is it helps to loosen a lot of the stains on your teeth. So if you're a coffee drinker like I am, or if you do any other bad habits like smoking, or if any other things that stain your teeth, you'll see that the Cavitron will really start to lift a lot of those stains away, which is awesome. Next thing that you're going to see her doing is she's actually going to be doing what we call hand scalers. So there's a variety of instruments that we use to kind of scrape the plaque off the teeth. And a lot of my patients will joke and say that like scrapey feeling, but that's what's going to physically remove the tartar and the plaque buildup. I always tell people when they come in to get their teeth cleaned, if you could clean that yourself, you would have done it already. Lots of people are like, are you sure that I need that? And I say, absolutely, because whatever you think that you can do at home, it is a partnership, the dentist or the hygienist and you. So even if you think that you're flossing and you're brushing, it is still of great value for you to have your teeth professionally cleaned, because without that, you really cannot access all the plaque that is on your teeth. As you can see, she's scaling my lower front teeth, and I had somebody else filming so you could get a little bit closer. And a lot of people, no matter how great their hygiene is, they'll notice a lot of plaque buildup mostly on their lower front teeth. We say that's their lower anterior teeth, and that is because a lot of saliva tends to accumulate at the bottom, and because the saliva accumulates there, it also puts more deposits, plaque, or we like to use the word calculus, and calculus just means, it is not mathematics, calculus just means there is plaque that is calcified and stuck to your teeth. And again, that's the reason you can't take away that plaque yourself. The next thing you're gonna see is her polish. After she's removed all of the plaque, then she'll polish the teeth using a handpiece that has a little prophy paste in it, and that's what we call it. Some of them have fluoride in it to help prevent decay, and she just goes around, and that also helps to remove stains and dark spots on your teeth. I always urge people who are always concerned about their teeth getting darker. I said, listen, you cannot whiten your teeth unless you've had a good cleaning, and a good cleaning is almost as effective as having your teeth whitened, because a lot of people will falsely mistaken the plaque buildup on their teeth for stain, when in reality they just need a really good professional cleaning. So here she is polishing and kind of giving a supercharged toothbrush all over my teeth. So here you can see I'm just admiring some of the blood that was created during the process. I really don't bleed when I floss because I floss pretty often, but I guess she found a little bit more plaque in that area, so she had to do a little bit more scaling. It really didn't hurt, I just was admiring it. So now she's giving me a really good rinse, and after the rinse we're gonna do some flossing. She's gonna get into there in between each the teeth. Of course, when a hygienist floss you, it's a little different than when you floss yourself, because they can get into all those hard to reach places. I always encourage people to ask their hygienist if they have any questions about how to floss and how to brush correctly, because believe me, they know best. And most people are really just trying to get in and out of there, but you really need to spend some time in between each tooth massaging on either side. And I actually have another video about, I think it's on my 7-day healthy mouth challenge, where I talk about flossing and I get really close to the screen to show you the correct way to floss. So she's just finishing up flossing to remove any excess plaque that got dislodged during the cleaning. And a good rinse. I'm feeling pretty good at this point. So the last thing that you're gonna see her use is something called Periodontal or chlorhexidine, and this product is a prescription product that you can get at your dental office, and it is an antiseptic. It helps to kill bacteria and kind of rinse away all of the things that were generated during the cleaning process. So you'll see her do what we call irrigation. She'll go around each of my teeth with a syringe. It is not pointy and it does not hurt, and it rinses away all the excess plaque and kills all the bacteria that was generated during the cleaning. I don't really like the taste. It doesn't taste so good, so you'll see me make faces. Some people like it. It has a minty taste. It's kind of strong. Some people like it and some people don't. It kind of depends on your taste preference. It's definitely not a product that I recommend to use on a regular basis. It's usually just something that we'll use like after surgery or doing your cleaning. So that's it. Thank you for watching. I hope you enjoyed this dentist going to the dentist again, and this time to get a cleaning. If you enjoyed this video, make sure to give me a nice thumbs up and subscribe to the channel. If you would like to see me get any other dental work or see anything of that nature, let me know and I'll be glad to film something else on the next time this dentist has to go to the dentist. Thank you for watching.